In this video you will get a reading task. First you will have to read the text about guidelines and answer a question based on the text. Comment your answer. At the end of the video you will get tips to understand this particular type of texts. What are you waiting for? Let's begin. The guidelines about breast pumps. Number 1. Turn on the pump and start with the stimulation mode, usually a faster, lighter suction. Number 2. After 1 to 2 minutes, switch to expression mode, slower, deeper suction. Number 3. Adjust suction level for comfort, never painful. Number 4. Pump for 15 to 20 minutes per breast or until milk flow slows.
Now answer this question. What aspect is mentioned about breast pump in the guidelines? Option A, troubleshooting malfunction. Option B, operating instructions. Option C, precautionary measures. Pause the video if you need time to think. Answer will appear shortly. The correct answer is Option B, operating instructions.
Now read another form of the guidelines. The guidelines about breast pumps. The use of breast pump should be avoided or delayed in case of severe breast infection, e.g., mastitis with abscess. Pumping may exacerbate pain or spread infection. Manual expression under guidance may be preferred. Post-surgical wounds or trauma to the breast. Pump suction can interfere with healing or cause bleeding. Uncontrolled hypertension or cardiac conditions. Stress or discomfort from pumping may worsen symptoms. Consult a physician. Recent breast surgery or implants. Use only under medical advice to avoid complications or damage to surgical sites.
Now answer this question. What aspect is mentioned about breast pump in the guidelines? Option A, contraindications to breast pump use. Option B, adverse effects of breast pump use. Option C, risks of using breast pump. Correct answer is Option A, contraindications to breast pump use.
Now read another form of the guidelines. The guidelines about breast pumps. All inpatient areas that care for infants of expressing or breastfeeding mothers have been allocated electric breast pumps. These should stay on their allocated ward except for when they are being cleaned. They are exclusively for use in the infant's ward area and should not be given to parents to take to their own accommodation.
Now answer this question. The guidelines about breast pump. Option A provides operating instructions. Option B restricts removal from ward. Option C indicates time of unavailability. Correct answer is Option B restricts removal from ward.
In OET Reading Part B, you'll encounter short workplace texts and be tested on your ability to understand the main idea, specific details, and purpose of these texts. Text on guidelines can be expected often in Part B test. In the guidelines they may talk about detailed instructions about operating some medical devices. Or they may mention other aspects like conditions during which the device should not be used or other aspects. While reading the text one should focus on what style has been used. The language used will vary depending on the aspect mentioned in the text. If you familiarize yourself with vocabulary used in this kind of documents, it will be easy for you to understand the give text. Now we will go through instructional verbs. Commonly used in hospital guidelines documents. Here's a list of instructional verbs commonly found in hospital documents, especially in clinical protocols, safety guidelines, and operating instructions. These verbs are vital for understanding tasks, responsibilities, and procedures in healthcare settings. Administer, example, administer medication as per dosage instructions. Attach. Example, attach the monitor leads securely. Check. Example, check equipment for faults before use. Clean. Example, clean the area with antiseptic solution. Connect. Example, connect the 4-line to the cannula. Cover. Example, cover the site with a sterile dressing. Dispose. Example, dispose of sharps in designated containers. Document. Example, document the procedure in the patient's chart. Ensure, example, ensure all steps are followed correctly. Insert example, Insert catheter using aseptic technique. Inspect. Example, inspect the equipment for damage.